The Center for Musculoskeletal and Metabolic Diseases of the Children's Discovery Institute is one of the 4 centers that focuses on promoting and facilitating research in disorders of the musculoskeletal and metabolic systems of children. I particularly study type 1 diabetes. This is the second most common chronic condition in childhood. There are 15,000 children every year diagnosed with type 1 diabetes in the United States. Children's Hospital has been at the cutting edge of taking care of children with diabetes. It was the first place in the United States that actually gave insulin to a child with type 1 diabetes in 1922. Insulin is the only way that we can treat children with type 1 diabetes because this disorder primarily is due to the lack or inability to produce insulin due to an autoimmune process that occurs in their pancreas that destroy the beta cells that make this hormone. So far, the only way that we can give insulin to children nowadays is with a shot. This has a big impact not only in the child and the way they live their life, they eat, they play their sports, but also in the whole family and the people that surround them. I study diabetes and hypoglycemia. Hypoglycemia is the most common complication of insulin therapy in patients with diabetes. Low blood sugars occur on a daily basis. People can have a severe hypoglycemic episode once or twice a year, but they can have low blood sugars at least 2 or 3 times per week. This actually has a big impact in their school performance, exercise activities, lifestyle, and family dynamics. So exercise is very important in people in general. It actually improves insulin sensitivity, it improves well-being, and children are running around all the time. So it's not like they just go to the gym and exercise. They are active all the time. And fortunately, it's been noticed that when people exercise, with type 1 diabetes, they are at higher risk of having a low blood sugar afterwards. And this can occur either immediately during the exercise period or even up to 9 to 16 hours after the exercise period. What has been noticed is that the adrenaline level, that the adrenaline secretion does not go up, neither they feel the need to eat or raise their blood sugar because they don't feel shaky or sweaty or silly. They might get stubborn. So we don't know why people lose the hormone and symptom responses to a low blood sugar. Dr. Philip Cryer, one of my collaborators, has devoted 30 years to try and answer this question. And we think that it's the brain that is regulating these responses. Prior research in our lab has actually shown that there are 5 particular regions that seem to have increased brain activity when a low blood sugar occurs, and people are feeling shaky and sweaty and stubborn and hungry. But actually, we found that when somebody loses these responses to a low blood sugar after having a prior low blood sugar, only the thalamus, which is a region of the brain, seems to be having increased brain activity. So what we're trying to identify is it that this region of the brain, the thalamus, is blunting all these responses. Although we found that this region was firing more after having a prior low blood sugar when the person's low blood sugar was low, we want to know if this is the same mechanism that makes kids unable to recognize their low blood sugar after they've exercised, so that they don't have the death in bed syndrome. So that they can actually not limit their lives from being able to go and ride their bikes, be part of the swimming team, be part of the track team in school, and be able to achieve all those goals that they've wanted. Now, yes, you'll say we're just identifying a brain region, but if we're able to identify the brain region or the mechanisms that are causing this phenomenon of losing the responses to a low blood sugar, we can better identify targets to prevent this problem in children, and in the future be able to design new pharmacological therapies for this problem.